You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Mark Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 13, Sidebone.
Introduction.
Sidebone is a common and historically significant condition encountered in farriery practice, particularly in heavier horses and those subjected to repetitive concussive forces. It refers to the progressive ossification of the collateral cartilages of the distal phalanx, more commonly described as the lateral cartilages of the foot. These cartilages are vital components of the foot, contributing to shock absorption, hoof expansion and dissipation of concussive forces during weight bearing and locomotion. When these cartilages lose their elasticity and become mineralized, the biomechanical function of the foot is altered, potentially leading to reduced performance, discomfort and long-term degenerative change. From a farriery perspective, sidebone is not simply a pathological finding, but a condition closely linked to hoof balance, conformation, management and shoeing practices. Understanding its development and implications is essential for making informed trimming and shoeing decisions that prioritise both comfort and long-term soundness.
Anatomy and function of the collateral cartilages.
The collateral cartilages are paired fibroelastic structures that extend proximally from the palmar or plantar processes of the distal phalanx. They rise above the level of the coronary band and play a crucial role in allowing the hoof capsule to expand under load. This expansion facilitates venous return, dissipates concussion and protects the internal structures of the foot from excessive mechanical stress. In a healthy foot, the collateral cartilages remain flexible throughout life, adapting to load and movement. Ossification represents a loss of this flexibility and marks a shift from a dynamic structure to a rigid one. While some degree of mineralization may occur as a normal aging change, particularly in large horses, extensive or asymmetrical ossification is more likely to be clinically significant.
Definition and pathophysiology of sidebone.
Sidebone is defined as the partial or complete ossification of one or both collateral cartilages of the foot. The process involves progressive deposition of mineral within the cartilage matrix, resulting in a structure that behaves more like bone than cartilage. This change alters the mechanical properties of the foot, reducing its ability to deform and absorb shock. The condition may be unilateral or bilateral and may affect the medial or lateral cartilage more severely, with lateral involvement being more common. The pathophysiology is multifactorial, involving mechanical overload, repeated concussion, conformational influences, and inflammatory change at the cartilage-bone interface. From a functional standpoint, the significance of sidebone lies not in the ossification itself, but in its effect on adjacent soft tissues, joint motion, and overall hoof mechanics.
Causes and predisposing factors.
The development of sidebone is influenced by a combination of intrinsic and extrinsic factors. One of the most significant contributors is repetitive concussion, particularly on hard or unyielding surfaces. Horses working extensively on roads, compacted tracks or firm ground are exposed to higher impact forces which are transmitted through the hoof capsule to the internal structures. When these forces exceed the adaptive capacity of the lateral cartilages, ossification may occur as a protective response. Body weight also plays a role, with heavier horses such as cobs, drafts and traditional working horses being overrepresented. Increased mass leads to greater loading of the foot and higher stresses within the cartilages. Conformation is another critical factor. Horses with upright feet, steep dorsal hoof walls or limited heel expansion are more likely to develop sidebone. In these feet, the ability of the hoof capsule to deform under load is already compromised, placing additional strain on the lateral cartilages. Poor mediolateral balance can result in uneven loading, leading to asymmetrical ossification. Long-term shoeing practices that restrict natural hoof movement, particularly the prolonged use of rigid shoes with limited heel support, may also contribute. Trauma to the foot, whether acute or repetitive, can initiate inflammatory processes that promote mineralization. In some cases, sidebone may be associated with hereditary tendencies, although this is difficult to quantify and likely interacts with environmental influences.
Conformational faults leading to sidebone.
Certain conformational traits increase the likelihood of sidebone development by altering load distribution within the foot. Narrow feet with contracted heels limit lateral expansion, concentrating stress within the cartilages. Upright pasterns reduce the ability of the limb to absorb concussion higher up, transferring greater forces distally. Toe-in or toe-out conformation can lead to uneven landing patterns, with one side of the foot consistently overloaded. Over time, this asymmetrical loading encourages unilateral ossification. Base narrow or base wide limb alignment may also influence how forces are transmitted through the foot, predisposing one cartilage to greater stress. As a farrier, recognizing these conformational patterns is essential for proactive management and for tailoring trimming and shoeing strategies to mitigate risk.
Static assessment of the horse.
Static assessment forms the foundation of any farriery evaluation and is particularly important in cases of suspected or confirmed sidebone. Observation should begin with the horse standing square on a firm level surface. The farrier should assess overall limb alignment, foot placement and symmetry. Particular attention should be paid to the height and width of the heels, the orientation of the hoof capsule and the relationship between the coronary band and the ground. Palpation of the lateral cartilages above the coronary band may reveal firm, immobile structures where flexibility would normally be expected. In advanced cases, the ossified cartilages may be visibly prominent. Hoof capsule distortion, such as flaring or asymmetrical growth rings, may indicate uneven loading patterns associated with sidebone. The condition of the sole and frog should be assessed, as reduced hoof expansion often correlates with decreased frog engagement and compromised digital cushion function. Static assessment also includes evaluating shoe wear patterns if the horse is shod, as uneven wear may provide clues about landing and breakover characteristics. This information is invaluable when planning corrective trimming and shoeing.
Dynamic assessment of the horse.
Dynamic assessment complements static evaluation by revealing how the foot functions during movement. The horse should be observed in walk and trot on both hard and soft surfaces. On firm ground, subtle gait abnormalities associated with sidebone may become more apparent. These can include shortened cranial phase of the stride, reduced heel first landing, or a tendency to land flat or toe first. In some cases, the horse may exhibit mild intermittent lameness that worsens on hard ground or when turning. Watching the horse on a circle can highlight asymmetrical loading, particularly if one cartilage is more severely affected. Reduced lateral expansion of the heel during weight bearing may be visible, especially when compared with the contralateral foot. Dynamic assessment should also consider the horse under saddle if relevant, as workload and discipline influence the functional demands placed on the foot. For the farrier, integrating dynamic findings with static observations allows for a more complete understanding of how sidebone is affecting the individual horse.
Clinical signs associated with sidebone.
Sidebone is often an incidental finding, particularly in older or heavier horses, and may not always be associated with overt clinical signs. Many horses with radiographic evidence of ossified lateral cartilages remain sound throughout their working lives. However, when clinical signs are present, they typically relate to altered hoof mechanics or secondary soft tissue involvement. Lameness associated with sidebone is usually low-grade and intermittent, often exacerbated by work on hard surfaces. The horse may show sensitivity to hoof testers applied over the affected cartilage region, although this is not a consistent finding. In more advanced cases, reduced heel expansion and rigidity of the hoof capsule can contribute to bruising, corns or chronic heel pain. There may be palpable heat or swelling in the coronary region during periods of increased inflammation. It is important to note that sidebone itself is not always the primary source of pain. Instead, discomfort may arise from associated strain on ligaments, joints or the navicular apparatus due to altered biomechanics. Accurate diagnosis and management therefore require a holistic approach.
Use of radiography in diagnosis and management.
Radiography plays a central role in the diagnosis and assessment of sidebone. Standard lateromedial and dorsopulmar views allow visualization of the extent and distribution of ossification within the lateral cartilages. Radiographs can reveal whether the process is partial or complete, unilateral or bilateral, and whether it extends proximally or remains confined to the distal region. Advanced imaging also helps differentiate sidebone from other conditions affecting the foot, such as fractures of the collateral cartilages or distal phalanx. For the farrier, radiographic information is invaluable when planning shoeing strategies. Understanding the precise location and severity of ossification helps inform decisions regarding support, breakover, and load distribution. Serial radiographs may be used to monitor progression, particularly in younger horses or those undergoing changes in management. While radiographic findings do not always correlate directly with clinical signs, they provide an objective framework for long-term management.
Trimming principles in the management of sidebone.
Effective trimming is central to managing sidebone and aims to optimize hoof balance, reduce excessive stress on the lateral cartilages, and promote more uniform load distribution. The primary goal is to encourage a symmetrical, heel-first landing that allows the foot to function as naturally as possible. Excessive toe length should be addressed to reduce leverage and improve breakover. Lowering the heels judiciously may help increase hoof expansion, but care must be taken not to over-lower and compromise support. Mediolateral balance is particularly important in cases of unilateral sidebone. Trimming should aim to level the solar surface of the foot and ensure that both sides bear weight evenly. Any flares or distortions that reflect uneven loading should be addressed gradually. Frog engagement should be encouraged where appropriate, as this supports the digital cushion and reduces reliance on the lateral cartilages for shock absorption. Trimming decisions should always be guided by the individual horse's conformation, workload and response to previous interventions.
Shoeing strategies for sidebone.
Shoeing plays a crucial role in managing sidebone by modifying how forces are transmitted through the foot. The choice of shoe should be tailored to the severity of the condition, the horse's discipline and the degree of comfort required. A traditional sidebone shoe, which mimics the wear pattern of the previous shoe and often involves a spiral medial lift, may be used to stabilize the hoof capsule and reduce excessive movement of the ossified cartilage. This type of shoe is typically fitted full on the affected quarter to distribute load more evenly. The shoe is often made from flat bar compared to concave to reduce grab and traction, which can increase strain on the ossified cartilage at the landing phase. Care must be taken to rasp down any protruding nail heads to again reduce grab as the shoe makes contact with a firm surface. Wide web shoes can help increase ground surface area and reduce pressure on specific regions of the foot. Rolled or rockered toes may be incorporated to ease breakover and reduce lever forces during the cranial phase of the stride. In some cases, bar shoes may be beneficial by providing additional heel support and limiting excessive deformation. The use of pads, particularly supportive or shock-absorbing materials, can help reduce concussion and improve comfort on hard surfaces. Pads may also promote more uniform solar loading when combined with appropriate packing materials. The farrier must balance the need for support with the importance of allowing some degree of natural hoof movement. Overly rigid shoeing that excessively restricts expansion may exacerbate problems over time. Regular reassessment and adjustment of the shoeing plan are therefore essential.
Pads and supportive materials.
Pads can be valuable adjuncts in the management of sidebone, particularly in horses that are sensitive to concussion. Leather, synthetic or pads made from a combination of both may be used, depending on the desired level of shock absorption and support. Full sole pads can distribute load across the sole and frog, reducing peak pressures at the heels. Soft packing materials can further enhance comfort and encourage frog engagement. The use of pads should be carefully monitored as they can alter hoof moisture levels and obscure visual assessment of the sole. Regular removal and inspection are essential to prevent secondary issues such as thrush or sole softening. This can be reduced by using antifungal clay or copper sulfate. When used appropriately, pads can significantly improve comfort and allow the horse to continue working within acceptable limits.
Long-term prognosis.
The long-term prognosis for horses with sidebone is highly variable and depends on several factors, including the extent of ossification, the presence of clinical signs, the horse's workload, and the effectiveness of management strategies. Many horses with radiographic evidence of sidebone remain sound and perform successfully for years, particularly when the condition is recognised early and managed proactively. In such cases, sidebone may be considered a manageable structural change rather than a career-limiting disease. Horses with extensive or asymmetrical ossification that are required to work on hard surfaces or at high intensity may face greater challenges. Persistent lameness or secondary pathology can reduce performance and longevity. However, with appropriate trimming, thoughtful shoeing and sensible workload management, many affected horses can maintain a good quality of life. The role of the farrier is central in this process, requiring ongoing assessment, collaboration with the veterinary surgeon, and a willingness to adapt strategies as the horse ages and its needs change.
Conclusion.
Sidebone remains a condition of considerable relevance in farriery practice, reflecting the complex interplay between anatomy, biomechanics, conformation, and management. While ossification of the lateral cartilages cannot be reversed, its functional impact can often be mitigated through informed trimming and shoeing. By understanding the causes, recognising the clinical signs and applying evidence-based principles to assessment and intervention, the farrier can play a pivotal role in maintaining comfort and performance. Ultimately, successful management of sidebone depends on viewing the horse as an individual and addressing not only the condition itself, but the broader context in which the foot functions. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.